What early signs of a stroke should you know to save a loved one? Is there a test that can be done at home? Find out the answers to these crucial questions in today's episode. So be sure to watch the video to the end. A stroke is a condition that develops due to a sudden disruption of blood flow in the brain. Blood continuously delivers oxygen and essential nutrients to the tissues, crucial for the normal functioning of cells. When blood doesn't reach the cells, they start to die. Stroke is most commonly caused by cardiovascular diseases that lead to the blockage or rupture of blood vessels. Experts categorize strokes into two types: ischemic and hemorrhagic strokes. Both are associated with a sudden disruption of blood circulation in the brain, resulting in damage to its structures. Ischemic stroke. Disruption of blood flow occurs due to a blocked vessel, often caused by injury, tumors, or other factors. Symptoms and early signs of this type of stroke in both men and women often have a gradual onset. This type of stroke is more prevalent, accounting for 80 to 85% of cases. Sometimes, it is preceded by a transient ischemic attack, where a person displays characteristic symptoms for a few minutes or hours. Brain cells are damaged but not dead, serving as a precursor to a future stroke. Hemorrhagic stroke. Brain structures are flooded with blood from a ruptured vessel. This condition can occur with a sudden rise in blood pressure, atherosclerosis, or aneurysms. The first symptom of this stroke in both men and women may be loss of consciousness. Hemorrhagic stroke accounts for 15 to 20% of cases. According to expert estimates, stroke ranks second globally among causes of death. Annually, 5 to 6 million strokes are diagnosed worldwide, resulting in the death of 29% of men and 39% of women. About 10% of survivors become disabled. Early signs of a stroke. The initial signs of a stroke can vary, ranging from subtle to overt. At times, the disease manifests slowly, making it difficult for both the patient and those around them to notice anything suspicious. By the time it becomes clear that a stroke has occurred, it may be too late to save the person. Speech impairment. One of the primary symptoms is a disturbance in speech. A person may struggle to respond, articulate, or comprehend spoken language. Their speech can become unintelligible, progressing to complete aphasia. Additionally, stroke can affect vision, leading to partial or complete loss, often occurring on one side. Headaches. Persistent headaches are among the early signs signaling elevated blood pressure. Headaches may result from the constriction of blood vessels and the stretching of veins in the brain area. This symptom should not be ignored, as it requires immediate intervention through traditional methods and remedies. Untreated, it may lead to complications such as stroke, heart attack, or retinal bleeding. Chest pain. Chest pain is a common symptom, often associated with heart conditions, warranting serious attention. In this area lie the heart, lungs, esophagus, major vessels, bones, and muscles. Chest pain related to the heart is typically felt below or slightly left of the breastbone, and it can be dull or sharp. People may also complain of pressure, a burning sensation, numbness, or discomfort in the chest, neck, arms, upper abdomen, and jaw. In some cases, there may be a persistent cough, difficulty breathing, and a reflex to vomit. Nosebleeds. Increased blood pressure places additional stress on the heart and blood vessel walls, causing them to thin and lose elasticity over time. Nosebleeds during heightened blood pressure occur because capillaries can't withstand the excessive load. Unfortunately, many people tend to overlook this symptom. Vision problems. The vision issues may arise, often affecting one eye. Patients may experience complete blindness or an inability to focus, as if seeing through a haze. The image may appear blurry, and moving eyes to the left or right may reveal blind spots. Memory loss. Brain damage and cognitive disorders are diagnosed in 44% of people with hypertension. High blood pressure adversely affects complex brain functions such as information perception, attention, speech, goal setting, memory, and overall intelligence. With blood pressure readings of 140/90 and a 10-unit increase, the risk of impaired brain function rises by 7%. In the early stages, cognitive disturbances are nearly imperceptible, with only minor memory deterioration. However, this progressive condition can lead to severe consequences and memory loss, eventually developing into dementia. Sensory disturbances in limbs. Sudden and pronounced sensory disturbances or motor weakness in one limb or one side of the body can indicate a stroke. To check for this sign, ask the person to raise both arms evenly. If one arm doesn't respond or lags behind, it may indicate a developing stroke. Motor disorders, focal symptoms, such as paralysis and paresis, are common motor disorders in strokes. Paralysis involves the complete absence of voluntary movements, while paresis refers to weakened voluntary movements. Depending on which limbs are affected or absent, strokes can be categorized into hemiparesis, hemiplegia, right or left side of the body; paraparesis, paraplegia, both arms or both legs; or monoparesis, one limb. Other stroke symptoms. As strokes can affect both large and small areas of the brain, the manifestations of the pathology can be unusual and not readily apparent. In some cases, an individual may not experience headaches, coordination issues, or visual disturbances during a stroke. Instead, there could be changes in behavior and personality, categorized as psychological rather than neurological disorders. For instance, sudden and uncharacteristic aggression, silliness, or untidiness may emerge. Conversely, the person might become excessively calm, avoid movement and conversations, exhibit apathy, passivity, and an inability to make decisions. At times, a stroke can mimic intoxication. Such manifestations of the pathology can mislead those around, especially when dealing with young individuals. These are relatively rare stroke symptoms. In the overwhelming majority of cases, strokes follow a classic pattern with symptoms described earlier. However, if someone behaves strangely or inappropriately without any apparent reason, it is advisable to consult a neurologist. In severe cases, such as when a patient becomes unreasonably aggressive, runs around, shouts, attacks others, sees non-existent objects, it's better to call for emergency medical assistance. Stroke test. If you suspect that you or someone nearby is displaying signs of a stroke, promptly call for emergency medical assistance. The first 3 points of our infographic can help confirm the presence of symptoms. First, smile. In a stroke, it will be asymmetrical. One corner of the mouth will droop. Second, palms. It's not possible to raise and hold both arms in the same position. Third, speech. Any phrase, even the simplest, will be a challenging task. That concludes our video. On this channel, you can find many interesting videos about the benefits and drawbacks of vegetables and fruits, as well as information about diseases and their treatment methods. Until next time.